if it comes from the specialist saying, look, you have cancer, you have whatever cancer, we know that smoking causes it. You should stop. I think just even one word like that probably gives them a bit of a fright and think, oh, now the specialists have told me that I should stop. I should. Because I think sometimes coming from me, the GP, they think, she just talks to me about quick smoke all the time. Like, I've seen her for 10 years. She tells me to quick smoke for the last 10 years. Like, I quit and I start, I quit and I start. So yeah, it probably doesn't give as much of an oomph, I guess, because yeah, because sometimes they do that. They only trust what the specialist tells them. If the specialist say they can't work, man, they can't work. You can't get them to move. If you're gonna make pamphlets from the oncologist, if you're distributing them to the Asian areas, you probably should have them in a different language because half the people I see, well, actually 80% of the people I see, they will not pay much attention to a pamphlet in English because it's very hard for them to understand it.
I think a cohesive approach is key. So I'm happy to prescribe the drugs. If the specialist initiates, that's wonderful. I can follow up as well. So it's all about a cohesive approach. So if all the practitioners are saying the same thing, then the patient is much more likely to consider treatment. Yeah, so more than happy for specialists or their team to initiate treatment, and then we as GPs can then follow up the treatment and continue that treatment. Look, a lot of patients there's a lot of respect for specialists. There's an immense respect for specialists because they're experts in the craft, and so if a specialist says one thing, the majority of patients would take heed of the warning. So we're happy to continue on with the treatment. So the specialists, if they're happy to do some in the context of, obviously they're busy outpatients, if they're happy for some brief intervention, we're more than happy to follow through. So a cohesive approach where the medical team is saying the same thing with regard to smoking cessation, I'm sure will lead to better outcomes.
Probably the main role would be planting the seed and then handing that over to the GP to water and cultivate. There's going to be a lot of information that the oncologist will be providing with the patient, and often if patients initially become a bit shell shocked, there's a lot of it. They just they might just hear their cancer diagnosis and be caught up in the treatment of that, and just not remember much of what else is said. So what one would be planting that seed, and then during kind of follow up, just I don't know if it's 6 monthly or annually or something like that, they can just just for themselves check, are you still smoking? Okay, have you chatted to your GP about that? Maybe you should chat to your GP about that. That way we can just work together. But I don't really think they should be trying to be responsible for the pharmacotherapy or the counseling, but they can, if they have an in-house service to refer to, if the patient's ready, that'd be handy for me to know about. But also just encouraging me if we or the GP to follow up and keep trying. Yeah.
Cancer management is pretty loaded anyway. There's a lot of emotion rolled into it apart from the actual condition. So I mean, I suppose if it's the team have a significant priority is smoking cessation, then usually giving them something, like a leaflet or something saying, this is what we've suggested, please discuss this with your GP. So actually raise it as an agenda item when you do see the GP. Because if that's not done, then they don't see that as, I don't know if most patients there'll be some that are going to be very aware that this is now a big priority for them, whereas there'll be others who will see it as, oh yeah, I've got cancer. But I've smoked my whole life. That's normal life for me. So they can downplay the significance of it. Probably end up being the CNC or one of the team. So I think if it's an important part of the management, then I personally think giving the patient a leaflet saying, this is really important and I want you to discuss this with your GP, I think that's a better way of getting the GPs engaged. Putting a leaflet in a bit of reply correspondence, I think, is good for ticking a box. I don't think it'll be as effective. Because, you know, if you give it to the patient to say, this is important to discuss with your GP, it's raised the priority of it. And then, you know, then there is the opportunity for the GP to raise it as a priority and to keep talking about it. I think most GPs tend to think in terms of a problem list and tasks to action. I think all doctors think that way, all clinicians think that way, you know, including the nurse teams and the allied health teams. They all think in terms of the problem list and how to action. So I think in terms of support being given, if it is deemed as one of the goals, even if then there is a time frame on that goals, I think that will really help. Because if, you know, like someone embarks on a cancer journey, okay, they're going to have their initial treatment protocols, whatever that might be, you know, and then there'll be the ongoing follow-up. So I think then with, you know, with all teams that you're working with, you know, if it becomes listed as one of the important things to achieve and a time frame on it, then it elevates it straight away.